I'm trying to get
Yeah.
to a place where you can see me better. Changing the positioning that I'm in.
Okay. Hello, everyone. Welcome to Ask the Nanny. Tonight we have a special guest who has quickly become a personal friend of mine. Um, just a little bit about her. Um, Let me make sure I turn my phone on so I can get the so I can see you all on Facebook Live, actually see you all because I'm going through Zoom. And I also want to make sure that um, you all can hear me. And I don't see me live on Facebook. I don't know what happened to me.
It says live on Facebook. It's
I don't know where I went on Facebook, but I don't see me live on Facebook. So I'll continue to try. Um, so hello
okay.
to everyone who has come in. Tonight we have with us, and there I am. I see. Tonight we have Miss Nikia Lawson, and as I said
Yes.
before, she has quickly become a friend, personal friend of mine. I met her at the first Sunday social for Ask the Nanny, and um, I remember when she stepped out of the car, and I was like, "Oh, I love that dress!" And that rest is history. So,
Yes.
Miss Nakia is a DONA certified
Birth
instructor,
doula. Well,
birth doula, and instructor, and I'll let her tell you all the ands and ands and ands because she has a resume
of
this
hands.
long.
A resume of hands. I love it.
Of hands this long. So, Miss Nakia, tell us a bit about yourself.
So I am Nikia Lawson. I am a birth doula. I am certified with Down International. I am also an approved birth doula trainer for Down International. I am also on the board of directors for Down International. So as you can see, I have a lot of affiliation with Down International. So I have been a birth doula for almost 24 years. 24 years this month. I have served families for lots of time, hundreds of families. I have been blessed to be a part of their journey to help them facilitate a healthy mom, healthy baby outcome. And I say that because to God be the glory, I have never lost a mom and I've never lost a baby. Yes, in 24 years, I've only had one infant mortality statistic. A beautiful angel who God called home 2 months to the day she was born. So I am grateful that in all my years of experience and working with families and helping them navigate and facilitate an experience through their birth journey, I have been a part of that on so many different levels. And not only is it, as their birth doula, I'm also a childbirth educator. I offer community childbirth education for free each month in the Fort Worth area, the fourth Saturday of each month in the Fort Worth area. I have the childbirth class. And then I also do breastfeeding education. I am a part of the Tarrant County Breastfeeding Coalition. I serve as the African American Breastfeeding Task Force co chair, where our focus is on African American families getting more information, awareness, and engagement around breastfeeding support in Tarrant County. So I facilitate the Community Lactation Educator Program along with Miss Amanda Alvarez. We do that as a part of the coalition. I also host a monthly latch clinic with my partner, Miss Miss Rose, who owns Children Family Institute. She's also a collaborator, a community collaborator with me in education, and we offer a breastfeeding lactation clinic once a month. I also offer limited postpartum support. I'm not a postpartum doula, but I do venture into postpartum support with lactation education, in-home lactation support, and placenta encapsulation. I also learned belly binding, bengkung belly binding when I was in Bali, Indonesia, and learned from student midwife there in Indonesia how to do bengkung belly binding. And so for a good while, it was a service that I offered as postpartum support. but I ventured more into placentas. I became more of a placenta junkie. So when people inquire about additional postpartum support, I do make referrals. I own and operate the Natural Way Birthing Project, which is a nonprofit that focuses on infant mortality awareness amongst primarily African American families, but we serve the entire DFW metropolitan community in offering education, advocacy, and support through our community education programs, as well as affordable doula care and lactation education, as um, as well as trainings. And so, part of what I do is train birth doulas and train community childbirth educators so that they can, in turn, go into our communities and work in tandem with families so that we could support and facilitate healthy mom, healthy baby outcomes. So when you talk about the resume, those are all the ands. And so for
And as you can see, there's a lot of
a
ands.
lot of and. So this and that and that and this and. Um, and I just embrace it. I embrace birth work. I've been a birth worker, like I said, 24 years now. And
Wow.
yeah, I started my journey. Um, and my first birth was with my sister. And I was studying engineering my entire life. From the time I was in the third grade at 9 years old, I wanted to become an electrical engineer. And I prepared for that all throughout high school. I got a full academic scholarship and I studied physics for 2.5 years on academic scholarship. I was like an uber nerd. Yeah, so I wanted to become a physicist and an electrical engineer. And God, I had a spiritual epiphany, and God had a different plan for me. And I ended up switching my major and literally venturing into social work. I ventured into social work, and I have an undergraduate degree in social work and a master's degree in counseling psychology. So I have spent years on the academic side, years in social service, and many, many years in birth support. So it's a little bit about the resume.
Okay. Now, I know you all know that lately I've been talking a lot about the birth world and the nannies and the NCSs and everybody coming together to speak the same language. And
Hmm.
Nakia is as you can tell, got all of this stuff going on. And I learn every time I talk to her, I learn something new. So tonight she is going to talk to us about community education. Now tell us, what exactly is community education?
Well, community education comes from the community health industry. So, from the perspective of individuals who are in communities, who serve communities that are from the community in which they serve, providing education to families that are going to help guide them towards a better health and wellness outcome, no matter what that is. So, community education has been around for a long, long time. A lot of times you'll have community clinics that offer like diabetes education or smoking cessation education, nutrition education. And so those have existed for, excuse me, those have existed for years, where individuals who specifically the idea around the community piece is individuals who live and serve within communities who know the resources that are available to communities are actually a part of the community in which they educate. And so that's the challenging part is when individuals who are outside of the community come in with a different lens, a different scope, a different ideal, and they try to educate communities, it doesn't seem to resonate very well. So the idea around community education is to train, empower, and allow a level of competence for individuals who are part of the community to actually go right back into their communities and educate families. So what I like to focus on is birth education. And so birth and breastfeeding education creates a sense of equity that allows families to be able to work in tandem with their medical care providers. So, right now, we're in a system where the media has propagated a message that women should listen to their doctors when they're getting ready to have a baby, and anything related to maternal health and wellness, your doctor has all the answers. We realize and recognize that the maternal health industry was created from a white male patriarchal perspective. That's the lens in which this industry was created. And so when the message gets propagated, listen to your doctor, the idea behind white male ideology dictating maternal health doesn't resonate well when maternal mortality rates are disproportionately affecting women of color, primarily African American women. So when Black women are dying at a rate 3, 4, 8, 12 times higher than our white counterparts, we have to figure out where we missing, um, and where is the gap in what's happening between those who survive this journey and those who don't. And so a lot of that is the education. But if the education is coming from someone who doesn't understand the community in which they're talking, who doesn't realize how to connect with the audience of people who need the information the most, then it's really not doing us any good. Because clearly what the doctors are doing and saying is not working because we still dying. And so if we get to a place where individuals within communities are teaching families within the same communities about resources that they can access within that same community or even outside that community, it makes it a whole lot easier for families to make better decisions, to have choices, to know their options so that they can feel empowered by those decisions and choices and options. And we'll have better mom baby outcomes. We'll see first birthdays. We'll have women living to tell the story about how they didn't die in childbirth. It's just too many of these stories are popping up. And now, with the advent of social media, we're seeing it more readily in our inboxes and on our timelines, in our feeds. We're seeing this Black mother died, my daughter died, my niece died, my cousin died, their baby died. We're seeing it all too often. When really, if we educate our community of families about the choices that they have and the opportunities that they have to get the knowledge that they need to have the birth of their choice, we'll change these numbers.
Okay. So your area is birthing,
Yes.
community education and birthing. Um, and I understand what you mean about mothers dying. I had one of my good friends just had a baby not long ago, and she was worried about dying because her doctor was insisting on having a C-section, and her doctor was insisting upon her taking medicines, and she questioned the doctor, why am I taking this medicine? And I do the same thing. Now I can't get pregnant no more, but when I go
Right.
to the doctor, I want to know what you are giving me and why you are giving it to me and the effects that it's going to have on my body. And I don't buy the medicine unless I know what the side effects are, what's in it, what is going to cause, because I know my body does not like a lot of medicine. I've had 90% of the medicines that doctors have tried to give me, I've had allergic reactions to it. My body
Mm.
was like, no, I'm not taking it, I'm not having it. And I stopped taking the medicine and found and searched for a more homeopathic way of uh, the medicine, the same reaction that the medicine would have on my body, foods and herbs and whatever would have on my body. Now, I'm not saying that this is for everybody, but I do suggest that you find out what you are putting in your body before you put it in your body, just because the doctor says, okay. I found out the hard way when my son was young, they were giving him, what is that medicine? Ritalin? I think that's what it was, and the side effects of the Ritalin. And I was like, no. And it was
Right.
supposed to be a reflux medicine, and it wasn't helping. And when I found out the effects of this Ritalin and um, what's that Ritalin? I cannot think of what the name of that was, but it was supposed to be a reflux medicine, but it was not
Hmm.
helping my son. It was actually making him worse. And so I went back to the doctor, and I became a rattling wheel, basically. And you know, a
Yeah, the
rattling
advocate.
wheel will
Yeah.
get
That's
attention. So I
yeah.
became
Squeaky
a
wheel gets the
rattling wheel.
oil.
So what I'm saying is educate yourself. And those of us who do community education, and when I say community education, Nakia is does birth education. I am here doing nanny and everybody else education, because I think that we should be well rounded, not just as know what's going on in the nanny field, but a lot of nannies become newborn care specialists, which makes you put you on another level of you're going to be there right after birth. So you need to know if that child had a rough birth, if mom had a rough birth, if you're providing
Right.
postpartum support. So all of this comes into, and we all need to be a part of this simply because after birth comes the newborn care specialist and the postpartum doula, and then comes the nanny. And
Hmm.
nanny, um, we're going to be there longer than the doula. We're going to be there longer than the postpartum. We're going to be there longer than the NCS. So we need to know where to pick up from
Yes.
where they left off. And if we're all speaking the same language and we're all communicating together and we're all educating that family from start till whenever you finish as a nanny, then that family has had a community through, I don't know how many women or how many,
Exactly.
all of us have had a part in their community, because a family is a community, because grandmas and grandpas are coming, and aunts and uncles and brothers and sisters and whatever are coming to visit that baby. And if something is going on with that baby, and somebody does something that they don't know is not right for that baby, and you're there, you need to say something.
Yeah.
It's all about the whole community. So as a nanny, I know, as a nanny, I can't tell you how many grandparents I've encountered, and things that they let the kids play with. I'm like, no. So yeah. So as a community leader, Nakia, how important is it that we, um, those of us who are leaders and those of us who have the knowledge, how important is it for us to go into our community to help our community, even those of us who really don't want to be helped?
Well, it's vital. It's not even so much as is it important. It's vital because we're talking about life and death now. When we live in one of the most industrialized countries on the planet, and we have the worst maternal mortality rates, that creates a level of emergency where the education becomes an emergent, vital part of the process of having a baby. It becomes a vital emergent part of the maternal health journey, whether it be preconception, the actual physical birth itself, or in that postpartum. Because statistically, a baby that's born and doesn't see his first birthday is an infant mortality statistic.
Really?
Statistically, yes, no matter what the circumstance is, that baby dies between its first breath until its first birthday. It is an infant mortality statistic. For a woman who has a baby, if she has a baby and within that first year after giving birth, if she dies for anything outside of a car accident, homicide, or cancer, it's considered maternal mortality. And so we look at the maternal mortality statistics of women who do not make it, and how skewed the data is. Because if a woman dies and a first responder comes in and says, "Oh, she had a heart attack," well, no one asked, "Did she have a baby in the last 12 months?" No one asked that question. It's just she had heart failure, or she had heart disease, or she had these other issues. So it's vital that our families are educated so that they can identify along the way. These are some red flags. These are some things that are causing concern. These are some areas in which I need to be a little bit more versed and a little bit more knowledgeable, because this could be a matter of life and death. And so there's not really an issue around community education being um, a proponent to create fear. So we don't want to educate families so that they're scared of what could
Right.
happen. We educate them so that they're empowered to make good choices. And so you don't know what you don't know. So for the families who's been burying their loved ones, they've been burying their daughters, their nieces, their cousins, those individuals don't know what they don't know. For this country to educate women that in the postpartum, your insurance in the United States is not going to cover your postpartum visit until 6 weeks postpartum. So most women are are not even prepared to go back to see their doctors until they're at least 6 weeks postpartum. That's about 44 days in most cases, between 44 and 45 days postpartum, that they're going to go and see their doctor, that their insurance is going to cover that visit. Most of these women are dying between 44 and
Between the
60 days postpartum. Yes, those
wow.
first 2 weeks postpartum are crucial. 2 weeks postpartum. Guess how soon babies get to get a postpartum visit that's covered by insurance and medical services here in the
Two
States?
weeks.
No, 3 days.
Three. Oh,
Babies,
okay.
yes, babies are seen within 3 days postpartum for a pediatric follow up. They schedule that before the baby leaves the hospital. Whether that mama's going to follow up with her pediatrician or the hospital pediatrician, that baby has a 3 day follow up. But mama doesn't get
Okay.
seen for 6 weeks. And she's more susceptible because be, here's what we don't think about, and we're not understanding from an education perspective. The reproductive system is working extremely hard when we're trying to build a healthy baby. Okay, there's a lot of big blood vessels that are going to our reproductive system. What is our blood tied to in our bodies?
The heart.
The heart. So if the heart is working that much harder to pump blood through the body, especially to this reproductive organ that started out the size of an avocado and now it's the size of a watermelon, a small watermelon, it's got to pump blood to clean blood, no less, to this organ that's got to grow a healthy baby. This blood flow provides oxygen to this baby. It provides
You pump
nutrients
it
to
for
this
two.
baby for two. So this heart is now pumping to not only support the life source of this woman, but also to help grow a healthy baby. So now let's imagine if there's dietary concerns, if there were other heart concerns,
Mhm.
if mama had other blood issues that she was dealing with prior to any kind of anemia that she had to deal with. And so when we find women in the postpartum having issues with hemorrhage, issues with high blood pressure, issues with heart concerns. These are all related to this pregnancy that nobody's really watching out for in that 6 weeks that it takes for her to go get seen by a doctor. She could be dead. She could be dead or almost dead, and that's what they consider maternal morbidity. And so, if it's not a maternal mortality situation, it could possibly be a maternal morbidity situation. And being in a maternal morbidity situation could leave a woman with lifelong debilitating issues. And these are concerns that no one is saying. Let's educate families about this before they get pregnant. Let's educate families about this while they're pregnant. Let's make sure we follow up and educate families in that early postpartum. Let's make sure that mamas realize and recognize if it don't seem right, it probably ain't right. Go get yourself seen about. We're worried, and our families are concerned. So we're talking about marginalized women. We're talking about low income women. We're talking about women who have inadequate health care. We're talking about non-English speaking. We're talking about individuals in our LGBTQIA plus communities who do not feel connected to the system. The maternal health care system does not say, hey, bring us all, the Bible says, bring us your poor, your meek, the less than. The Bible says that, not the healthcare system. The healthcare system ain't operating like the Bible. Okay. So they're not saying bring
Right.
us all those people. They're saying, please take care of yourself until you can afford to come and see us or until we'll pay for it. And if you can't, pay us out of pocket. So how many families are thinking, oh, I feel bad. I'm gonna go ahead and just pay this copay or this out of pocket to go see my OBGYN at $150, $200 a visit. They're just like, no, I'll just wait till my 6 week checkup. I'll just wait. Or they
Wow.
end up in the emergency room. And the emergency room says, oh, you just had a baby. We're going to go ahead and let you follow up with your OBGYN. And they send them home to bleed to death. Or they send them home for their heart to stop pumping. Or they send them home and they have an embolism and they end up dying from a blood clot. And so it gets to the point we have to educate women. So not only is the community education giving them information, it's also giving them their power back. Because again, you don't know what you don't know. And so if it's vital for me to know this information and I know that I could find someone who will help me navigate this system according to the information that I do have in my repertoire of information and skills, I'm gonna go find somebody to see about me. I get call after call after call every day, or at least 5 times a week. I'm getting a call from someone who's saying, Miss Nakia, I got a friend, I got a cousin, I got some, they trying to find a doctor. I got a call today from a young mother who found me through someone else who's trying to see about her teen daughter who's expecting. And she said, my daughter is 30 weeks and every time she leaves her doctor's appointment, she want to cry. And so we gotta find your daughter another provider. And you need to get educated as to what questions you need to ask when you go into that visit, because it does you no good to just switch doctors and you still don't know what to ask. You still don't know what to expect. You still don't know what options you have. You still don't know how to work in tandem with that individual to get the desires that you feel for your experience. I tell mamas all the time, your body, your baby, your birth. Your body, your baby, your birth. Therefore, you get to make some decisions. I liken the birth experience to a hairstyle. So when I educate mamas, I always ask mamas, yes. And see, I have been to the barbershop, so I can't take my hat off right now. But
Okay.
I liken it to a hairstyle. But even me, and I'm bald, and so when I go to the barbershop, I tell my barber specifically how I like my hair cut. He knows how I like my line. He knows I like it rounded. I like it to be, I don't want those sharp masculine edges on my face. I don't want the back of my neck tapered really, really nicely. I want it really, really low. So I go in very specifically, giving him an idea of how I want my hair cut. I spent time researching the barber that I wanted to use. I didn't just go to the first barber. I had to see what kind of work they did. We, on the other hand, when it comes to our birth, we don't think of it as a consumer service because the media has propagated it as a medical emergency. There's a pathology to birth that we have to fix it because there's something wrong. So we have to have doctors monitor it just in case something goes wrong, versus realizing and recognize that her body was divinely designed to birth her baby. And so if you liken it to a hairstyle, I ask mamas all the time, would you walk into a salon and sit down in the chairs and say, do whatever you want to do to my head? No.
No,
None of us would.
no,
No, none of us would. We would all have an idea of what we want our hair to look like. Same thing when you go in the nail salon. You know what color polish you want to wear. You know if you want a design or not. You know if you want a round or square. You want ombre. Do you want acrylic or gels? You know. You spend more time researching beauty regimens than you do researching your birth, because that message that's been propagated. Listen to your doctor. They have all the answers. And so I tell mamas, if you wouldn't go in there and sit down and let somebody just do whatever they want to do in your hair, then you shouldn't do that with your birth experience. You should spend the same amount of time researching about your birth, about what you want. And most mamas don't know what they want, but they damn sure know what they don't want.
true,
Hello. Because the
true.
first thing they say is, I don't want to have a C-section. Okay, well, let's start there. I don't want to have a C-section. Let's talk about what you can do to avoid having a cesarean. Let's talk about the support you can put in your life to help you get to the desires of not having a cesarean. Let's talk about your lifestyle and what's going on in your lifestyle that can help you avoid the cesarean. So we can work back from what you don't want. Or some may say, I want to have a water birth. I want the candles. I want it the way I see it. And thank God for social media. So now women are seeing more options to having their babies and flat on their backs, pushing their babies out with their legs in stirrups. That's all they've seen forever and ever because that's what they show on TV. But now with social media,
It's the media that
yeah,
pushes
now
those
but now they
scenarios.
yeah, but now that message that's been propagated that you go into the hospital because your water broke, you're gonna get rushed into the delivery room. They're gonna put you on the bed, put your legs in stirrup, and you're gonna push your baby out. And after the commercial, you're gonna be holding a 3-month old. That's the scenario we see on TV,
That
right?
is, I always say that baby is not a newborn.
That's not a newborn,
That,
right?
and my
Right. They can't
husband looks
cast
at
it,
me like, "Why are you ruining the show?" I said, "But that baby is not a newborn.
right? Because
That
that's what.
baby," and they put a
And they always
little
cut.
wetness on the top of the
Yeah,
baby's head
and
on
they
his
and
cheek.
they yeah, all they so jelly they put on babies. Babies don't come
And
out
I was
bloody.
just
Babies are
like,
in
I
amniotic
know
fluid for
this
40
is
weeks.
TV. I
Oh,
know
this
this
is
is
TV.
TV because there's no cord, there's no nothing. It's just like they got a little wetness on their forehead and something on their
And
cheeks.
it's always some kind of red looking jelly. And I'm like, babies don't come out bloody. They in water for 40 weeks. They not coming out bloody unless there's something going on with the placenta. So we know this, but then that's what
Okay,
education does for us.
I have some comments. Um,
Yes.
Misha says, "Oh wow," and Krisha says she's
Hey, my
waving both
boo.
hands.
That's my
And
boo.
Misha says that it's an amazing comparison. And Angie said, great idea. I often use the same analogy, but with the wedding planner.
Yes.
And Emily said, preach. And hi, Rose, how are you? Emily also says, and so many mamas believe the myth of once a C-section, always a C-section.
Let's talk
I
about
had
that.
I had a successful, wonderful VBAC experience by researching doctors willing to do
Yay.
VBACs.
Good for
Myrna
you.
says, let's see what Myrna's saying. Hold on. Myrna says, how can an individual postpartum doula be a bridge of support for marginalized women and still work for the educator and the client? Hold on, let me read that.
Okay.
How can an individual postpartum doula be a bridge of support for marginalized women and still work for the educator and the client? So,
So I'm
how are you
thinking
going
what
to be a
she's saying,
bridge?
right, from a postpartum doula perspective. So postpartum doulas go in and work with the families in a short window of time to support the mother transitioning or the birthing person. And please forgive me for my lack of inclusivity in my tone. I do acknowledge birthing persons as female, and I will do the rest of this not to discount individuals who do not identify as female but are birthing. For all those trans females that are birthing, just for the sake of our talk tonight, I will refer to them as the birthing mother or birthing women. No disrespect. So I just want to get that out the way before I start answering questions. So when the postpartum doula comes into the experience, they're there to help facilitate um, the birthing mother transitioning into motherhood. Okay, and so whereas birth doulas, we support the prenatal with education, information, and support. We also facilitate the actual birth itself. We're in the delivery room with the family, and then in that immediate postpartum, which is typically about 2 to 3, maybe even up to 4 hours after the baby is born, and then we move on. We'll do one, maybe two follow-up visits in the postpartum, but we're not in the home. Whereas a postpartum doula would then pick up from where we leave off, and they're in the home consistently for several hours at a day, or even in the overnight hours, to help this mom transition into motherhood. So you've just had a baby, there's a lot of emotion going on, there's a lot of hormones going on, and so trying to facilitate that to understand what does this transition look like for you venturing into this whole new journey and taking care of this little person that needs you 100% of the time for all of their sustenance and survival. And so postpartum doulas help in that regard. One of the things that postpartum doulas can do in terms of the education is helping families, especially when families are like, well, we don't need a birth doula. I've got a big team, but I am going to need some help in the postpartum area. That education piece is making sure that moms know what questions to ask if they're going to a childbirth class. So moms should ask about, how do I navigate breastfeeding? How would I navigate my own personal time, self care, navigating self care in the postpartum, understanding postpartum wellness from the perspective, again, of blood pressure, bleeding, the moods that are involved in the postpartum. So that long-term mood stabilization. Can we identify what does postpartum depression look like compared to baby blues that may lead over into like postpartum psychosis or something to that effect? If mom is on any kind of medication, how is that medication going to continue to be administered in the postpartum as she's transitioning into motherhood? Would that make an impact? What if her birth resulted in a cesarean delivery? What kind of support is going to be for her wound care and taking care of that incision? Because she has two. You have to be mindful. She has an abdominal incision that you can see. So you can see that one. The question is, what's going on with the one on her uterus? That's the one we need to be concerned about. That's the one that has to heal over the course of time in a certain way. Is she having any issues with incontinence or bladder incontinence? Is she having any issues with intimacy with her partner? Being able to reintegrate sexual activities with her mate. All of these are questions that would come up in the postpartum journey for a mother, that a postpartum doula would be right there in her home, hours at a time, day in, day day out. And whether she's doing night care as a postpartum doula or she's there during the day, she's facilitating this transition into motherhood. And that education piece between the birth doula, the childbirth educator, the postpartum doula, and the mother is again vital. I hope that answered that question.
It answers some questions for me. But I always, as a newborn care specialist, we are taught to recognize certain things about postpartum. We are not uh, able to diagnose. Oh, well, you have postpartum depression. No, that's
Yeah,
not it.
postpartum
When
doulas just don't
and
either.
I always ask my clients, "What is your postpartum plan?"
Plan.
And they're like, "What's that?" And so
Hmm.
I just asked them if mama is acting a little off. I said, who is the person that knows them well enough to know whether mom is okay, this is her normal behavior, or if mom is, like you said, the difference between the baby blues and postpartum depression.
Yes.
Baby blues is one thing, but the postpartum depression, who is the person that I need to contact and talk to and say, okay, I think mom needs some help. I have a list of postpartum, doulas. I have a Rolodex on my phone of who I can call, who is available to come and help this mom. Now, I also tell them, you know, sometimes it may just mom needs some fresh air to get out of the house, to self-care, to
Right. That
feel
self-care piece.
better. But sometimes it's like you can tell there's a detachment between mom and the baby, or mom just wants to be left alone, or she doesn't even want to look at the baby. There are things going on. Who can I talk to and tell this is what I think you need to get some help for mom? Is this her normal behavior? And if not, then I think we need to look at getting a postpartum doula in here. And postpartum doula says, okay, we need to take this even further. We need to go to the doctor or whatever. I can't tell her that. All I can do is recognize that she's acting kind of strange. Let me talk to someone. And I tell
Right.
the mom this. I said, I'm telling you this now before you have these babies because I don't want you to feel like I'm ganging up on you and I'm causing the problem. I said, you may
Hmm.
not even conversation when it happens. But if it happens, I'm telling you now that I am going to talk to dad, to grandma, to best friend, to whoever it is, your person that you give me, and ask them, is this how she normally acts? Is this normal for her? Does she usually do this, this, and this? Or is it the detachment that she has from this child? Is this normal? So that I can get her the best help that I know to get her. So I can start calling in help early instead of waiting until mom is just completely out of it and too far gone for anybody to do anything except for taking her and hospitalize her and all this other stuff.
Right.
The sooner you get help, the better. So
So true.
I always ask that question because it's important to me for mom, especially first time moms, and not that all moms, even if they're second or third time moms, but especially first time moms who have never experienced this, who don't know, that it's coming or they can experience it. I try to get them help as especially them. I want them to have the best experience with their child as the best experience possible. And if that means calling in for some reinforcement and some help, then that's what I am there to do. Now I don't know about anybody else, but that's my plan. That's what I do. And going to classes and going to and listening and being in lactation educator class and new parent educator classes and all this teaches me, okay, so you need to look for this, you need to look for that, pay attention to this, pay attention to that. And even as a nanny, postpartum
Yes.
does not end at 6 weeks. Just because you start when that baby oh, I'm off work for 2 months and mom's going back to work, mom may have a breakdown just going back to work.
Yeah.
You need to be able to recognize these things. At least take a class of, you may not want to be a postpartum doula, but take a class that will allow you to at least know some of the symptoms, or at least alert you to call somebody else who does know what they're doing. So that community education,
It's a
go
big
get it so
piece.
you
It's
can help your
vital.
community.
Yeah, it's vital. That's why I say these are vital pieces of the puzzle. There was another comment made about VBACs, and I love talking about VBACs. There's a young lady in our community, Althea Hurd, who basically that is her brand is all about prepping for peace as she relates to her childbirth education. She does community education as well in the Cedar Hill area, and her focus is on moms who've had cesarean deliveries and who have a zeal and a desire to have a vaginal birth after cesarean. We call them in our industry VBAC. And so a woman who has had a cesarean birth who aims to have a vaginal birth, she can opt for a VBAC. The challenge becomes finding a provider or a doctor who one sees the importance of a VBAC because the message was propagated, and again, white patriarchal medicine, that once you have a cesarean, every subsequent birth, every subsequent pregnancy must be a cesarean delivery. And that's
Mhm.
not true. There have been so many women whose bodies that were designed to have the birth vaginally that it resulted in a cesarean could justifiably have a vaginal birth with the subsequent pregnancy. So once a C-section, always a C-section is an old myth that does not exist. However, not every woman who has had a cesarean birth is a candidate for a VBAC. Guess how we know? We get educated. I tell women all the time, if your vaginal birth results in a C-section, find out the scar that's on your uterus. That's the one you can't see. We can see the one on your abdomen, the little bikini cut that's right below your panty line, or the one that goes from your belly button down to your panty line along the linea nigra. We know that one. The one that's on the inside, that's all sewed up and tucked back under muscles and tissue and fat and everything else, and all stitched up on the top, that's the one we can't see. That does make a difference, and that is an indicator as to whether or not a woman is a good candidate for a VBAC. There may be some other health issues that she has that may not make her a candidate for a VBAC. There may be some other concerns that exist in her medical history that do not make her a candidate for a VBAC. But once a C-section, always a C-section is not an accurate statement. However, women should have these conversations with their providers long before they choose to get pregnant again. And they should always opt to have a low transverse incision on their uterus, which makes them a better candidate for the VBAC option for every
Say that
subsequent
again.
pregnancy.
Say that
They should
again.
opt, they should talk to their doctor about a low transverse incision on their uterus. So
Okay.
they don't need to be having these conversations when they're in the throes of labor and they about to get rushed back for a C-section. It should be, okay, my goal is to have a vaginal birth. If my vaginal birth results in a C-section, can we consider the low transverse incision so that I'm a candidate for, I'm more of a candidate for a VBAC. Those are just little things that women can have a conversation with their provider about before they go into labor. When I educate as a doula, when I speak as a trainer, and when I speak on platforms, when I'm a guest on a podcast, I always talk about the vital importance of all of this information being relayed before they go into labor. In the throes of labor, that pregnancy brain kicking in, that support person is like a deer in headlights. That doctor comes in and it's a whirlwind of things going on. Or guess what? Might not even be your doctor. You might get whoever's on call and they don't have an idea what your desires are. And so, unless you have a competent doula in the room with you,
Mhm.
unless you have an empowered support person who is educated, unless you have had a conversation with your provider and your team about what your desires are for your birth experience, you at the mercy of whoever does what to you how they want to. And some of these doctors are fossils. I mean, they like 800, 900 years old, creeping in the delivery room with their own ideology, with their own ideology, coming in, trying to help deliver babies in the new age with these millennials that have cell phones at their hands and information at their disposal like that. But guess what? When Dr. Fossil comes through the room, you at the mercy of Dr. Fossil.
So you
And
have
some
to tell Dr. Fossil what you want.
and sometimes you don't even know what to say because you thought you had it all worked out with your doctor, or everything was going really really smoothly, and now there's an intervention in birth. Like to teach it when birth becomes challenging. When I teach, when birth becomes challenging, intervention may be necessary. That could be the difference between a vaginal birth and a cesarean. That could be the difference between a mom being skin to skin and her baby being at the warmer. That could be a difference between her holding her baby in the room with her, or her baby being getting special attention in intensive care. All of those make a difference. But we have these conversations, we get this information before we go into this birth experience. So we know how to navigate this journey. And it's always better with a doula on the team.
Yes, it is always better with a support person, whoever is there with
Hmm.
you. I,
Competent, a
I'm
competent
a
doula
competent.
on the team. Yes.
Yes, vital word, competent.
Competent.
Vital word,
Yes.
competence.
And there's
So,
another thing when it comes to education. We need to be mindful that when we're getting educated and things are happening in the birth experience, because it does happen so fast, there are things that are going on in the moment. And so there are so many things that can happen because birth can change on a dime. It's not predictable and it's different for every single woman. So if something is happening in the moment and you have a competent support team with a professional doula that is a part of that journey with you, they should be able to help navigate so you can ebb and flow and make sure that the desires are still regarded, but then those biases and those microaggressive behaviors that tip the turning point in these birth experiences, they get minimized. So I tell people all the time, you don't necessarily need me as your doula in the delivery room. I would love to be at every birth. I can't. So part of the reason why I'm a trainer is because I'm out here trying to train competent doulas to be out here doing the work that's necessary to help us save lives. And so they might not necessarily need me on the team, but they need to get educated so they'll know what to say to their doula, to their doctor, to their partners, to their family members, to the nurses at the hospital. All of these people are part of the experience and part of the journey. So if mom has the education, if support person has the education, if partner has the education, if cousin has the education, if
right,
auntie, if Miss Johnson crossed the street and she done showed up at the house while we talking about some of this stuff, if she gets educated and she be the only person with that mama that day when she goes into labor, guess what? Now Miss Johnson is a little bit more educated than she was the day before. That's
right.
why we teach in community. That's what community education does. Is each one teach one, reach one. If we're all reaching out to each other to make sure that we're all educated collectively, like you said, we sharing the same information. We become
Right.
one voice. One voice will tip the scale. The one voice mentality, the one voice approach, it will shift the narrative. It will change the messaging. And these birth outcomes are going to change. And Black women, marginalized women, non-English speaking women, immigrant women, indigenous women, not LGBTQIA women, and men and families, it's going to change because
Yes.
we will incite a maternal health riot. It will be a maternal health riot because families are educated. They're just saying, we prefer not to go that route. We want something different. We choose to take our money and our insurance somewhere else. We choose to go get care somewhere else. We're gonna take back the power to have our babies the way we were designed to. We don't want to listen to all this messaging and this propagated mess. Basically, that's the first four letters of the word message. Mess. And what age does the mess come from? Mess age? What age does the mess come from? Is it just new age or is it an old age? But either way, it's a bunch of mess if it's been propagated by this male patriarchal society and media.
Right. We definitely need to uh, speak the same language. And that's one of the main reasons why I wanted you to come on, because I know since February, and it's almost February again, I have
Yes.
been trying to get together here locally with the birth workers, the NCSs, the nannies, bring us all together so we can have conversations, so that we can all learn from each other. I need to know what you're speaking. I need to know your terminology. So when you say VBAC, mom is like, a who? A what?
Right.
What are you
Right.
talking
Right. Right.
about?
Or
And I
TOLAC.
can
Or
come back
TOLAC.
and
Yeah.
explain, right. And I can come back and explain to her, VBAC simply means a vaginal delivery. And they
After
understand that.
cesarean. A vaginal
Right,
birth after cesarean. Yes.
right. After cesarean, sorry. After
Yeah.
cesarean.
Yeah.
I can come back and I can explain that to her. I can tell her, that you need a support group when you go into the delivery room, not just your doctor and his nurse, or whatever doctor is on call.
Say
Because
that.
when you are in labor, whoo, and I've been there 3 times, when you are in labor, it happens, like you said, so quick.
In the moment.
I had my they came and checked me. They said, "Oh, you're 8 centimeters. It'll be a little while." Within 10 minutes, 10 of them, I had it. I was 10 centimeters. Baby had crown. My mama said, "Oh, look at all that hair," and I'm like, "Wait a minute! I thought she said I had." I was not ready because I'm preparing myself mentally. Okay,
Right.
so you're gonna have to push. You're gonna have to do this, and I'm preparing myself. And in 10 minutes, I'm just like,
Got a
"What?"
whole baby out here in these streets.
Thank you. She told me that don't sneeze. That's what she told me. I was still in the room. I hadn't even made it to the delivery room. I'm still in the room off
Wow.
to the side. I'm just still in the
Triage.
labor and delivery.
Yeah, you
I'm
in
in the labor and
triage.
delivery
Yeah.
ward. And I'm just like, okay. So then by the time I get to the delivery room, he's slipping on out of it. It wasn't no matter
Yeah.
of a push. He was coming. That was it.
Because the body is designed to expel this baby. The uterus is a muscle. The uterus is a
It was
muscle.
like,
And this muscle is
get out of
squeezing
here.
this whole munchkin out your body and pushing it through your vagina into the world. So you got a whole baby out here in these streets. Okay?
That's right. And like I said, they will tell you one thing, and it happens so quickly.
Because your
My
body was
second
designed
one,
to get this baby out.
they said, "Oh,
Yes.
oh, he'll be here in a few minutes." It was another 3 or 4 hours. So,
There you go.
like you said, they can tell you, predict. Okay, it's gonna be this long. We got to 8 centimeters and we stopped. And I was like, "Boy,
Yeah.
don't even come on here. I'm tired."
Right.
So it just depends on each birth and each child,
Everyone is
and
individual.
every mom is different. And just because the first one came late doesn't mean that the second one's gonna come late.
That's true.
Because my
And
first one was
estimated due
3 weeks
dates. That's the
late.
reason why we call them estimated due dates, because there is no accuracy in when babies decide they want to come
That's
into the
right.
world. And these documented time frames, as I like to refer to them, that's a time frame that they gave. It could be off by 2 weeks either way.
Or more than that.
Yeah. And so, because babies come when they get ready and they know how they need to be born. And so babies know how they need to be born. And I tell moms all the time, listen to your body. Get to know your baby. I ask moms all the time, have you seen Miss Puss? The last time you seen Miss Puss? You need to put a mirror down there and look at your vagina so you can see what's going on. So you'll understand when something's not right in your vaginal area. Have you ever seen Miss Puss? All the ladies out here looking and watching this podcast. When you get off this podcast, go get you a mirror, go in the bathroom and take a look at Miss Puss. Every woman should know what's going on with her reproductive process. Every woman should know we're not teaching our young girls about the reproductive journey. We're not teaching them about their bodies. They don't, I can't tell you how many young mothers, even old women for that matter, not old, I'm sorry, mature women that I've supported who don't know how they got pregnant. They don't know the process of ovulation. Don't be surprised. They don't know the process of ovulation. They don't understand what a period is and the menstruation process, and they don't understand the ovulation process. They don't understand that their baby is growing in their uterus, and the uterus is a muscle. So I've talked to teenage moms as young as 13 and women as old as 43 about the birthing process and did not know when, where, and how their babies were growing.
Okay.
So, oops. So let me turn this off. Okay. So yeah. So excuse me. So the phone is ringing. Who has landlines? Go figure.
I didn't know they made those anymore.
They still have those. It's almost like a
Oh my
payphone. That's a
gosh.
dinosaur. So yeah,
So,
so that's what I love about community education. You get a chance to empower families with content and knowledge and context that they're not going to get when they sit down. Doctors have 10 15 minutes, if that they spend with these birthing families. They're in and they're out. They've got another patient. They've got charting to do. They may have to leave and go to the hospital and deliver a baby or go to a scheduled cesarean. So you're not going to get that one-on-one time. However, women are now choosing to go with midwifery care. So they're going back to the traditional midwives. They're going back to women who can sit down and have conversation with them, talk to them, love on them, give them a sense of connectedness, not only to their body, but to the journey of birthing their babies. And so that's a piece of the puzzle that I am so excited to see the resurge, because again, it started with the grand midwives when they stole us from Africa and they brought us over here. They didn't bring slaves to America. They brought midwives. They brought professionals. They brought doctors and lawyers and accountants. They brought those individuals. They just happened to be in Africa, but that's what they brought to America, and they turned us into slaves. They incited a slave mentality. That's what ended up happening. But those women who had the skills and the capacity to catch babies in the motherland, they came over here and they caught babies here, and we call them our grand midwives. We have given them homage over the years for all the skills that they have passed down to become the mothers of midwifery. That was the backs of Black women in which this industry was built. So from obstetrics and white male doctors using Black women as slave guinea pigs to practice their medicine on, to perfect their sciences. I do not give credence to any white male who named any part of my body. I don't call it a G spot, it's a V spot because it's in my vagina. I don't refer to the spines of the pelvis as ischial spines because I don't know who Ishia was, but it's probably some old white European male doctor. I can't give credit to these people because you didn't even give credit to me as a woman, to acknowledge me as a woman, to even give credence to the sacrifice that Black women made to create an industry that does not even regard us to this day. That's my truth. I continue to speak that truth, and that's what community education does. It doesn't dictate that I have to say it the way the hospital wants me to say it. It doesn't dictate that I have to teach you how to be a good patient. It allows me the opportunity to empower you with knowledge and understanding that this industry was built on our backs, and we must take this back so that we can rewrite our own message. And so it's not mess. It's not mess. It becomes the power that we take back to have healthy mom, healthy baby outcomes, to see first birthdays, to celebrate those milestones with our babies, because we're here to tell the stories. We're in the pictures. Can you imagine how many pictures of first birthday candles don't have mama standing next to them? Can you imagine how many mamas leave the hospital with an empty womb and empty arms? We can negate that with a lot more community education.
now I have one last question for you. And you just mentioned teaching moms to be good patients.
Mm.
That struck a chord with me because I know that I'm not a good patient because I ask questions and I
Oh, that makes you a great patient.
know what I'm saying. You say being a good patient. I,
Oh
I
yeah, I know
know
what you
what you
mean.
mean when you say good patient. Just
Oh
lay here,
yeah,
let me do what I need to do to you, and you go by and see you.
that's
I
exactly
ask
what the good. Yeah.
questions and I ask, and the doctor's looking at me like your 15 minutes are up. I'm like, I'm paying you, so I get to ask questions. And
Yes.
well, check back with you. No, I'm here now and I'm paying this money now. And even if it's just my $25 copay, I'm going to get my $25 worth because not only am I paying this $25, but I'm paying these thousands of dollars into insurance to say that I'm well and I am one of the blessed ones. Well, I only come see you once a year. So if I'm coming to see you once a year
I
and
want
I
my
don't
just
have
due.
any, and I don't have any other problems, but I'm paying you thousands of dollars plus my $25, then I'm going to be a great patient and I'm going to ask you my great
Lots of
questions.
questions.
Yes, I have a list. And honestly, when my NCS parents asked me, what's going on with my child? What is this? I said, well, talk to your pediatrician. These are the questions that you need to ask. I will give them questions to ask. I am not diagnosing your baby, but I am giving you questions to ask, which will lead you to a better diagnosis because you don't know what to ask. And
Because you don't know what you
that
don't know.
that right, you don't know what you don't know, but because I have been in offices with parents with their babies, and the doctor's trying to brush them off, and I said, well, I have a log, and I will bring my log with me to the doctor's office and say, on this day, on this day, on this day, on this day. No, it didn't just happen once or twice when mom was at home. It happened numerous of times, which means that there is a problem. And because mom doesn't know how to ask you, I'm going to ask the questions for her because she's unprepared. So, as a nanny and a part of the community, a part of the village, I'm going to ask these questions because I know that she doesn't know which questions to ask, and she's already asked me. Okay, so if I miss something, then you ask the doctor. Okay, I will do that. And she just sits back and she just kind of looks like, and when I get done, they're like, wow, I didn't know to ask all that. I didn't know all this was going on. I just read the notes. There's a pattern. That's why I'm here to watch the child's pattern. And when that pattern differs from what is quote unquote normal development in your child, then that's what I'm here for, to stress to your doctor, this is what is going on. What do we need to do to fix this? Or what do we know? What is the diagnosis? What is the prognosis? Whatever we need to know this.
So in the birth world, it's a little different. So what we're aiming to do is empower our families because we provided them all this information and education before they've gone into their birth experience, that they speak for themselves. So doulas don't speak on behalf of our clients. And so if I'm in a doctor's appointment with a mom and there's a couple of questions that was probably on her birth plan that she wanted to ask, I'll say, remember what we talked about? Remember we talked about such and such. Do you want to talk to your doctor about that? So it empowers her to say, you know what, I do have that question. So she's going to have all the questions laid out. And so we're going to give her good, competent doulas are giving families all the questions to ask ahead of time. And if it's something that she doesn't think, that she doesn't know to ask, then it's like, you know what, can we have a moment? And so I'm going to discuss this. Well, your doctor said this, and here's some things that I think you're going to think about and consider. Now, when the doctor comes back in, talk to the doctor about X, Y, Z, one, two, three. And so then that gives the mother her voice. And so if we give women back their voices, then they'll
Mhm.
be more empowered to speak on behalf of what's going on with their children when their babies are in primary school. It'll give them back their voices from kinder, from daycare to kinder to primary to post to secondary to post secondary. Because then they're like, along the way, I've learned how to ask these questions on behalf of my child. And I've learned how
Right.
from the womb to the tomb. I'm going to ask some questions that's going to benefit the outcome of my baby's health and wellness or my own health and wellness. But if I step in and I start asking those questions, they're going to look at me like, Miss Nakia, now what? Miss Nakia, now what? See, well, I may not be at your next appointment, but I still need you to be empowered. It's like, oh, I don't have a piece of paper. Oh, I don't have Miss Nakia here. Now I don't have a voice. Let me help you find your voice. Let me sit here beside you and empower you and cheerlead you on so that you ask the questions that's necessary. So the next time, and I may have a follow up call with you and say, so how'd it go? So did you ask your doctor those questions? Well, no, I didn't ask him this time. Well, feel free to call him up. You don't have to be in the doctor's office to ask that question. Ask his nurse. Call his nurse manager and ask the question that you forgot to ask in the office today. Get those questions answered. Again, that $25 I'm paying for, that insurance that y'all gonna bill for that I pay into, this is the reason why it exists, so that I could
Yep.
get my questions answered. And so me empowering that family, that mother, that grandmother, that auntie, that husband, that boyfriend, that quote unquote baby daddy, it's my responsibility as her doula before she goes into labor to have the questions to ask so that she knows. And then that postpartum piece, where does the postpartum education come in? Give her the questions to ask so that she'll know and she'll be prepared so she can think it through. Ask her team, ask her church members, ask her mommy group, find other individuals to get the support from. That's where it's important. Going back to your question about being a good patient, I taught in hospitals. I taught in 3 different hospitals in DFW during my journey before I strictly focused on community. And so I taught at Methodist, I taught at Charlton, and I taught at Hughley here in Tarrant County. Those are the two Dallas County hospitals I taught in for 3 years, 3.5, 4 years at Methodist Dallas. I taught for a little short stint while the traditional educator was out on medical leave at Charlton. And I taught for a couple of years over here at Hughley. And in that time, I had to ask, is it my responsibility to teach them how to be good patients, or is it my responsibility to educate them and empower them to have a satisfied and empowered birth experience? Because if I can't, through education, help them facilitate a positive and satisfying birth experience, then I'm doing them a disservice. And if y'all want me to teach them how to be a good patient, I sit up in here and kumbaya for 12 hours at a time just so I can make $25 an hour. Let me know so I can find somewhere else to go. So I thank Danny Cagle, who was my supervisor at Methodist over in Dallas, for the time that I was there, because she gave me complete reign over that childbirth class. And I educated several hundreds, if not maybe 1,000 families in the time that I was there, to empower them. So I wasn't required to teach them how to have a good birth experience. And my predecessor, when I audited the class before I took over, I asked her during the break, do you go over comfort measures to prepare the families for those who want an unmedicated birth? Oh, no, they just laugh and play. So that's not really important. Really? Oh, okay. And so then I talk about, do you go over interventions, the benefits and risks, and how it's administered? Oh, well, they're gonna do that in the delivery room, but they need to know what's gonna happen, the benefits and risks, and how it's gonna be done to their bodies. They needs to be educated about that. So I realized and recognized then that her class was teaching them how to be good patients. And her class was teaching them, how to act when you check in, where you need to go, what you need to do, how you need to respond. And she did go over some of the signs and stages of labor, and there was a video for them to watch on different birth experiences. But a good majority of 12 hours of education was focusing on patient interaction, patient relationships, patient nurse engagement. And that was the least of my concern. My concern was, do you have the questions to ask so that you're going to have the birth of your choice? Now, we appreciate you choosing our hospital. And didn't matter which hospital I was teaching in. I'm going to thank you for choosing our hospital. And then it turned out that people were starting to come to the class that wasn't delivering at our hospital. They were coming. And I was like, so where you having your baby? She said, I'm having my baby in Fort Worth, but I heard this class is $25 on Medicaid, so I'm over here with you. So I said, oh, okay. So I have quite a few families that were not delivering at Methodist that were coming to Dallas to take the class because they were getting empowered to have the knowledge to have their birth, and they were learning comfort measures because not everybody wanted a medicated birth, and that's okay. And some of these women were hiring doulas and they were laboring at home, and that's okay. And then they would show up at the hospital to meet the baby. That's okay. So I'm gonna teach you how to have an empowered experience. And if you learn some of the tactics on being a good patient, because I believe good patient care is, don't pack all that stuff to the hospital. All them bags and all, you got a bag for you, a bag for the baby, a bag with all your little toiletries, a bag with all, and then you got to pay. And then folks is bringing you stuff after the baby comes, and girl ain't gonna make it to the house. I'm gonna drop this off here at the hospital with you and the baby. I bought you a little layette set. I bought some little outfits for the baby. I'm gonna bring you a pack of Pampers. They bringing all that to the hospital. So now you got to go home with all that luggage you done brought like you was on vacation. You got a newborn, a car seat, and all these gifts that came from friends and family that you trying to haul your husband down the street with so he can bring the car around. And where's all this gonna fit? Don't do it. That's good patient relationships. Come to the hospital prepared to have a baby, not to go on vacay. And it does make a difference.
Okay.
That's about as much as good patient care as I'm gonna tell. That's how you be a good patient. Just don't pack all that stuff.
Okay. I have last three comments.
Sure, sure.
Krisha says, my 20 questions for your HCP, I'm sure has some HCPs upset with
Healthcare providers.
me.
Hmm.
My expecting students ask them all. So, in other
And
words,
and
she
Krisha
sends
does,
them
yes.
with her 20 questions.
Yeah, Krisha does too. childbirth education for the community as well. She does a free class a couple times a month, which is amazing. She also has a brand that's called Train for Birth, where she prepares families for unmedicated out of hospital birth experiences. And then she does a day long event called Train for 10 centimeters to
Yeah.
kind of bring in myself. She brings in a chiropractor. She brings in a midwife, talks about the natural process and the laboring process. She talks about postpartum support, what that looks like. And she does those events several times a year. So Krisha Crosley, another wonderful community educator, Althea Ward, a wonderful community educator. These are people who are part of the network that I started. So I know for a fact they bringing the goods. I
Okay.
know for a fact they bringing the goods.
Now, Eve Birth says,
Hey, Eve.
as a doula, I remind my clients to ask the questions as well. Physicians tend to always share the risks, but what are the benefits? What are the alternatives? Can I have some space to think about this? And she also said, I stand firmly beside them, encourage them to speak up for themselves and support their decisions without bias.
Exactly. And we have to teach that. We have to teach that as educators. We have to teach that as support persons, as birth workers, and maternal health professionals. That when we see birth through a certain lens, or we see a specific group through a certain lens, whether it be a narrow lens or a wide lens, it impacts the way we provide care to them. And so we have to recognize that our biases exist. I always ask the women in my trainings, and this is when I facilitate doula trainings, one of the questions that I ask them is, do you see color? And so I asked them all, Black women, white women, Hispanic women, the Asian women, the indigenous women, whoever's there, I'll ask them, do you see color? And it doesn't surprise me that many people say, no, I don't see color. Color doesn't exist. We're all just one people. It's like, honey, but I need you to see my blackness. Because I promise you that doctor gonna see my blackness. I promise you that nurse gonna see my blackness. And depends on the lens in which they see black people is how they gonna treat me. And I need you to be ready, and I need you to be prepared to help keep me empowered to be able to stand in my truth during this birth experience that's going to take me topsy turvy and all over the place. So, this is a part of the competency piece that a lot of doulas, unfortunately, are not getting not being equipped with.
Mhm.
I definitely know for a fact the doulas that take my training are being equipped with this information. The doulas who take my training are being equipped with the education piece, to sit down and facilitate a birth plan with their client. And whether that plan gets executed to perfection, which it hardly ever does, because birth is unpredictable, it still has been documented that these are the desires of the person that's about to have this baby. And so together we work in tandem with the doctors. We don't go in there ready to fight and create a battle. So education cuts down on the fighting. Education cuts down on the as these folks call trauma and trigger. Girl, if I read one more post about a doula that's being trauma and triggered and traumatized by birth experiences, if you are educating your clients, they are picking the right provider that's not traumatizing them. My mamas aren't traumatized when they go in to have their babies. Because if at 20, like the young lady that called me today and said, my daughter's 30 weeks, I said, baby, let's find somewhere else. I will exhaust my resources to find your daughter a provider that's not going to traumatize her. So when she goes into her birth experience, she's empowered. And unfortunately, the healthcare system exists. And unfortunately, there are limits and there are not as many opportunities in one community versus another. We're in birth utopia here in DFW. I tell mamas all the time, if you're black and you want an all black birth team, I can put one of those together for you. Or you're a Latina and you want an all Latina birth team, I can put one together for you. If you don't speak English, I speak birth. So I can put that birth team together for you. Because
Speak
I'm
birth.
bilingual, honey. Baby, I'm bilingual. I speak English and I speak birth. I tell people that all the time. Yes. And so that's what happens when you have the resources like we have here in DFW. These resources aren't everywhere in the country. They ain't everywhere on the planet. But if I empower you with education and you stop right where you are and you think about what you want for your experience and then you seek that out in your community, there's no reason why you can't have the birth of your choice without trauma and triggers and pain and disgust and anguish and tears. That just don't happen with the families I serve. And it doesn't happen with the doulas who serve the families that come through my program.
All right. And you do travel and teach doulas.
I
Miss
train doulas
Roxanne.
all over the planet. So I
I
have,
know. I
yes,
keep up with your travels.
yes, I
Where
have
you?
been blessed. Yes, I
Mm,
have been blessed
uh,
and privileged to
last
be.
month, just last month, you were somewhere. I was like, where is she going now? And
I
then
was trying to get to Scotland.
that's where you were going. I knew it
Yes,
sounded, I almost said Switzerland. I said, no, that ain't the right
Scotland.
answer.
Yeah, it was Scotland.
Okay.
Just trying to, yes, flight, yes, the dramas of the Chicago O'Hare Airport.
Oh my,
But and that's part of the birth work I do as a birth business coach. So I do branding and client acquisition coaching with doulas who are trying to build their businesses and establish their brand. So I have spent a lot of time learning and gaining the knowledge to help guide birth workers through their journey for themselves. And so that's what my brand, Birth Blessings, is all about. So Birth Blessings Professional Birth Services is all about training doulas, mentoring doulas, coaching birth workers to help create their brand for their birth businesses. And then I have the Natural Way Birthing Project, which is a part of the community work that I do, which offers an opportunity for me to work with families in community, doing community education for free. So all the education that the Birthing Project, the Natural Way Birthing Project does is free education. We do not charge families, not at all, not one time do we offer these classes that it's going to cost the family. So the program has some wonderful collaborating partnerships, individuals who seek out and provide donations. The community has rallied together around me during, this tumultuous time that I'm dealing with right now with the loss of my supplies. And so just to know that our birth community is really, really concerned about education, concerned about community education. I live in community. I serve my community. I educate my community because I want people to be aware of what resources are available in the community so that they can have these healthy mom, healthy baby outcomes, as well as see first birthdays. That's my goal. That's my plan as I continue to fight for maternal health and wellness amongst all women, but primarily amongst Black women.
great. Eve Burst says so much truth, sis. Love, love, love you.
Love
Education,
you too.
victory, empowerment. And that is the end of Ask the Nanny for tonight. Thank you so much for coming and sharing with us and empowering us because and I always, like I said, I always learn something new when I talk to you.
Oh, thank you.
Always, always, always. And that's why I can go back to my NCS clients and say, this is what you're supposed to be doing, or that's what you're supposed to be doing. Especially, and it adds questions to my list of things to ask them before they give birth to their children. Because most of my
Yes.
clients are still pregnant. Some of them have already had the baby, but most
Soon
of
to
them
the
are still
class.
pregnant. Most of them are still pregnant. So I add questions and I have resources. And like I said, I have a Rolodex on my phone of people that I can call and put you in contact with. Oh, here's that person's number, here's this person's number, and this is what they do. And that's why it's so important for us to get together during these Sunday socials and have these conversations and have these talks so that everybody is speaking the same language. We may
At the
have
same time.
at the same time so the family can have a beautiful, wonderful birthing and
Ex-
postpartum experience.
Experience.
And we can
Yes.
get to age one.
First birthdays. We need
First birthday.
365 plus one.
365. Okay, there you go. 365 plus one. Now,
That's it.
what I'm going to ask you to do is once we're done to go on Facebook and put your information
Sure.
about your all three of your whatever, all your companies, all the things that you do,
All the
put them
teams.
in the comments so that when people come back, some people don't watch the video, they just go through the comments to get the information so that your
Hmm.
information is there. And for those of you who are watching, please share this video with your friends, with your moms clubs, your
Yes, all the pregnancy people come to the Natural Way Birthing Project fourth Saturday of every month except December. Not the last Saturday, but the fourth Saturday of every month except December. On Facebook, you can go to our Facebook page, the Natural Way Birthing Project. We have room every single month for as many expectant moms as necessary. Not as many as we can hold, but as necessary to get this information. I will not turn a family away at all. We have affordable doula care, $300 if you're in Tarrant County. If you're a Black woman, you're on Medicaid, you're delivering at our county hospital, $300. If you have private insurance, $400. If you outside Tarrant County, $500. Very affordable doula care. Have an entire team of doulas who are trained, competent. Some are even certified. Some are part of the birthing community as chiropractors and herbalists and other specialists, and they still serve families through the Natural Way Birthing Project. Lactation education, in-home lactation support, all of that exists. So this is a part of who we are, and there are so many more opportunities that I can tap into for resources on the other side of the county, Tarrant County, Dallas County. We have Abide in Dallas County. Again, we have Althea and Cedar Hill, Krisha, circumventing Tarrant County as well. These are the people who are part of my network who have extended so much love around community education. These are the community educators that I'm very, very familiar with, that I know. If there are more of us out there, please don't forget to put your information in this chat as well. It's not just
Yes,
me, and it's not about me. It's about this community of families who need to
community.
get it. Yes, so please, if you do education and it's a nominal fee, and you are providing resources to the community, share your information so that we know who you are and that we know how to get in touch with you. And if you're NCS and you want to learn more about childbirth education, please come and join us on fourth Saturday. If you're a postpartum doula, please come and join us on fourth Saturday. I would love for people to find out what I share so that you can share with your family. So you're going to get some good information. Plus, we feed you every month, free food.
And nannies,
So
I
yeah,
encourage you to go so that you will know
yeah,
what's going on because a lot of us are taking care of big brother and big sister while mom's walking around pregnant. If something is going
yes.
on with mom and she doesn't look quite right, you are the first point of contact. You are
Or
the
if she
first
going to
person to
labor.
call. Thank you. So you will know what to do. And I
Yes,
know most of my 90% of my clients from the time I became a nanny back in 2000 till now have been mostly babies. And if it wasn't a baby, it was a baby being coming. I was taking care of
mm-hmm.
Big Brother, it was a baby coming. And this information, man, I wish I knew all the stuff back then that I know now. I could have
Pass it
changed
on.
the world. But nannies, I encourage you to take these classes too, because they are, like she said, they are free. It's
Mine are free.
her, her classes are free. And when
Not
I
all
say
of them are
these
free, but
classes,
mine are.
take her
Most of the
class,
community classes are free.
and most
Most
of
of the
the
community
community
classes are free.
classes are free. There's a
Yeah,
there's a small nominal fee,
some of
but
them have.
it
Yeah.
is worth it. It is professional development because you are becoming more empowered. You are becoming more educated to take care of the families that you apply for. You know they're having a baby or whatever. You become number one on their list of people to hire because you know
Yes.
what's going on ahead of time, as opposed to someone who's just coming in after 3 months. So I'm just saying, I'm with you. So
Yes.
thank you again for coming. Thank you for sharing. Thank you so much. And I will see you on Sunday.
Yes. Thank you.
Yeah.
Much love.
Okay.
Love and blessings.
All right. Good night, everyone. I hope you all have a blessed, very blessed week.
Love and
And
blessings. Good night.
good night.